My name is Selçuk Peker. I'm a professor of neurosurgery, and my main subspecialty in neurosurgery is functional neurosurgery, stereotactic procedures, and radiosurgery. DBS means Deep Brain Stimulation. We use this kind of surgery for Parkinson's disease, dystonia, and essential tremor. With DBS surgery, we apply an electrode in the brain to the very small targets in the brain, very small nuclei in the brain, and we give continuous electrical energy to that area. So it changes the behavior of neurons in that area, and the patient's complaints related to those diseases are getting well after the surgery. All over the world, mostly we use DBS surgery for Parkinson's disease, essential tremor, and dystonia. Of course, there are some other diseases can be treated with DBS surgery, for example, obsessive-compulsive disorder, depression, sometimes epilepsy, but these patients are very low for today, but most of the patients are with the first three indications. For Parkinson's disease, dystonia, and essential tremor, of course, the patients should be treated with medical treatment at the beginning. And if the patient doesn't respond to the medical treatment, then as a consilium, we evaluated the patient and the response to the medical treatment, then we can decide about the surgical treatment. Of course, not all the patients are a candidate for surgery, but in most of the patients, surgery really can help their diseases. For Parkinson's disease, the aim of the procedure DBS is to have a good quality of life for the patient. We cannot treat the Parkinson's disease. Of course, the patient should continue with his life with Parkinson's disease, but the complaints are a little bit lower than before. For dystonia and essential tremor, they are mostly static diseases, and all of these patients with these three diagnoses, in most of the patients, more than 80% of the patients, they are happy with their DBS surgery. Many years ago, I operated the patient with tremor. She was a young girl, 14 years old girl, and she was with a left-sided tremor, very huge frequency and huge amplitude of tremor, and it was very bad situation for her. Then we applied DBS surgery for her almost 15 years ago, and she is much more better than before, and now she is working. She has a good blog in the internet. She is very happy, and of course, when I see her, I'm getting very happy too. For movement disorder surgery, for Parkinson's, essential tremor, DBS, these are all movement disorders. For movement disorder surgery, the indication should be evaluated by a consilium. There is neurosurgeon, neurologist, psychiatrist, psychologist, physiotherapist, physical therapy specialists. All are these specialized doctors are in the consilium, and the patients are evaluated in this consilium. And if the patient's clinical situation is found okay for surgery, if the patient received enough amount of medical treatment, we decide to continue with DBS surgery. Then we hospitalize the patient and do the surgery in one day, and the night of that day the patient should stay in the intensive care unit. Then the patient stays in the hospital for 4 or 5 days. Then she can, or he or she can go to her home. And after 2 weeks or 3 weeks, we begin to open the generator and begin to give the electrical stimulation to the desired area. And of course, if the patient has tremor, we can see the response very early, in the very early phase. For bradykinesia or the difficulty in walking in the Parkinson's in the moderate period. But for dystonia, we can see the response in the late stage. After some months, you can see the benefit of the surgery.